Hi, so I wanted to teach you about some complications with different fluid levels in the amniotic fluid. So, namely, if there's too much amniotic fluid, which is called polyhydramnios, or if there is not enough fluid, which is oligohydramnios. I'm sorry, I can't talk that well. Both of these can cause complications for both mom and baby. So how we would go about seeing if the mom is having too much or too little amniotic fluid is we can really kind of tell in our clinical setting when we're assessing the client. So if we're concerned, or one thing that would lead to concern about polyhydramnios is if we're having a hard time feeling baby. We can't palpate the stomach, or we can't palpate baby in the uterus. We can tell by measurements, sometimes like the mom's girth is just bigger than be expected, or the fundal height is larger to be expected. It can also be kind of difficult to hear heart sounds when there's a lot of fluid. So in this case, we would want to send the client in for an ultrasound to assess if they do in fact have polyhydramnios. So how they would do that, I think it's important to first go with the normal range of amniotic fluid should be between 550 and 1,650. That's about standard, a good healthy amount of amniotic fluid for baby to thrive in. So they can tell how much fluid is in there, the amniotic fluid index, by different pockets around baby. The most common used one is called the deepest pocket volume, or DPV. So they would go ahead and measure the deepest pocket of the sac that isn't occupied by baby or umbilical cord. So with that measurement, normal is anywhere from 2 to 8 centimeters. So if there's too much fluid, that pocket's going to be deep, it's going to be filled with too much fluid, it's going to be anything over 8. So it's concerning when you have polyhydramnios because it can lead to bad positioning for baby. Baby can flip, there's lots of space to move around. It's just like a big old swimming pool. So baby can flip, it can go into breech position a lot easier. And then probably another concern is umbilical cord prolapse. So like the umbilical cord can be delivered first, and we all know that umbilical cord is needed to give baby oxygen, so that can be a problem. On the flip side, with oligohydramnios, I'm so sorry, I'm struggling with that hydramnios word. I'm just going to shorten it to oligo. Oligo is when there's not enough amniotic fluid. So when assessing a client and we're starting to get concerned about oligo, we're going to be able to either see like the outline of the baby, be able to just kind of like feel that there's just not enough fluid protecting baby. We can, the opposite of having too high of a fundal measurement, it might be lower, not as much. So like if she's 28 weeks, maybe we're measuring, only around 24 weeks. So that would be concerning. So when we send in for an ultrasound, the deepest pocket volume is going to be less than 2 centimeters. The risks of this are going to be kidney issues for baby, breathing issues for baby, and a higher case of fetal mortality. So both of these would risk the client out of midwifery care, and I hope that I covered everything. But yeah,